But for second year, third year, and fourth year, you know have not named summer. Hi there, and welcome back to this side of the internet where we're all about growing together. I'm Aneikia, a fourth year nursing student in Jamaica and a Christian content creator, and I'm all about sharing my experiences with you. I'm currently in fourth year, so I started a series related to sharing my experiences throughout the different years of nursing school. So this would be episode 2, as I will be sharing how my experience was for year 2. You have not yet watched my first year nursing school experience, then I'll put the link in the description box below, and it should be popping up here soon, so you can go watch that one and come right back to this video. So for me, second year was a bit better than first year because I was now more experienced, getting used to the college life, having online classes, doing coursework, things like that, and really understanding the whole concept of nursing and being in nursing school. So I was more prepared mentally, emotionally, and possibly physically too. So now I'll just be telling you the courses that I did in second year. I'll start off with first semester, then I'll go to second semester, then summer semester. Yes, we have summer semesters, and I'll share the grades I got for these courses. So for semester 1, the first course I have here is Introduction to Professional Nursing, and this basically tells the scope of practice as it relates to nursing. It speaks about the evolution of nursing, how nursing was years ago compared to how it is now, and it deals with things like legal and ethical principles in nursing. So things like confidentiality, maintaining privacy, autonomy, beneficence, doing good to the patient, not harming the patient, things like that. So for this course I got a B+, and it was a fairly good course for me. I really actually enjoyed reading the content and just understanding more about this aspect of nursing. The next course I have here is Patient Care Concepts Applied to Nursing, and it's basically about taking care of the patient in different settings. So we learned how to do hand hygiene and the importance of hand hygiene, bed bath, bed making, and just the different types of bed making in the hospital, such as surgical bed, open and closed bed, giving and removing of a bedpan, and things like catheterization, how to clean the catheter, how to do perineal care, things like that. This is the theory aspect of the course, as we have a practical aspect in second semester, and I got a B- for this course. Next course I have is Health Assessment, and it's basically just learning how to assess the different systems of the body. So we did abdominal assessment, cardiovascular assessment, respiratory assessment, and just conditions related to those systems, and how to know that, okay, if I do this assessment and I get abnormal findings, basically findings that aren't normal obviously, then what does it indicate? It was a really interesting course, just to go to school and learn how to assess different systems of the body. We practice on our colleagues, of course, and this is one of the courses, along with Concepts Applied to Nursing, that we get what you call checklists for. I'll probably insert one right here. So checklists are basically the steps that we follow when we're doing certain procedures, and I encourage you, some schools have it on paper, as in PDF format, and you have to print it, and some schools have it in books. So for my school, we have the checklist sent to us by our lecturer in a PDF format or Word document, and we print it. So that's something very important to have, because when it comes to being in the clinical setting, being in the hospital setting, these are the steps that you need to follow in order to do certain procedures. Now, another thing to add is that you might go into the clinical setting and you're not seeing the nurses do exactly what you're seeing on the checklist. They might skip a few steps, which should not be, but I encourage you to practice what you have on that checklist, because when it comes to exam time, when the preceptors come in to assess you for exam, they are going to go by the checklist, and I believe each each step is worth 1 mark. So you know, if you miss one step, even if it's as simple as identifying a patient or introducing yourself to the patient, then you can lose 1 mark. And 1 mark might sound like a little bit, but the more those 1 mark add up, or you get less of those, it will affect you greatly. So for health assessment, I got a B, and best believe I was 1 mark away from getting a B plus. So you know, getting a 1 mark in that clinical setting and 1 mark extra, it is worth a lot. Health assessment, we had a practical exam. However, this exam was not done in the hospital. It was done at school in the lab. So we did the exam on mannequin. So that was our first ever practical exam, and it was fairly good, to be honest. When it comes to these courses, I encourage you to practice and practice even more, and try to follow the checklist as much as you can. If you have to work on it, if you have to practice with your friends, with your family members, please ensure that you practice as much as possible, as the more you practice is the better you will become at perfecting these skills. The next course I have here is the nursing process, and the first thing you learn in nursing process basically is ADPI, which is just an acronym for assessment, diagnosis, planning, implementation, and evaluation. And these are just the steps that we take when we are caring for any patient in any setting. So first you have to assess the patient, gather your subjective and objective data, then you come up with your nursing diagnosis, and you start with your planning. What exactly do I want this patient to achieve over what period of time? Then you're going to have your implementation. So we have our nursing interventions that we come up with to say, okay, I need to put these things in place so that this patient can improve or basically can be better. And then you evaluate. So these interventions that I put in place, were they effective, or do I need to add some more? Do I need to, get some more persons involved in the care for this patient? So that's basically what nursing process is all about. And for nursing process, I got A minus. So the final course for semester 1 is
human pathophysiology. No.
If you're in nursing school and you've done this course before, we know what pathophysiology can be like. Now, human pathophysiology, basically it tells about different conditions as it relates to the human body, things that affect the human body, how it links, how the different system links. When someone has a certain condition, which organ does it affect, and when it affects that organ, what's going to happen to the other organ that it might be linked to. It's a whole lot. So in simple terms, according to Google, pathophysiology is a study of how a disease, injury, or other condition affects a patient, including both the physical and functional changes that occur. So when it comes to this course, our lecturer really came to class with PowerPoint with like 160 slides, and this was for most of the PowerPoints. A good amount of the PowerPoints were over like 80 slides, so you have to go through all of that and ensure you know what's on each slide. It was really a lot, and I got a B minus for this course. And just me, when I saw the grade, because I was actually expecting to get a C, but I give God thanks and I move on, because this course is no pushover. And this course, along with the other nursing courses that I've mentioned, are courses that you take to 4th year of nursing school and throughout nursing. So it's best to just do what you have to do, get the information in your head however you can get it in your brain, and do your best. So the next course I have here is pharmacology and therapeutics in nursing. So this is basically just about medication, administering medication, names of different drugs / medication, the therapeutic effect, side effects, contraindications of different types of medication, meaning that if a patient is on a specific type of medication, what should they not take with it, such as alcohol or milk. And this course also focuses on the calculation of different dosages of medication, and just everything to do with medication, the rights of medication, so you learn all about it. The next course I have here is health promotion. It's basically just learning how to promote health. So in the simplest way, health promotion deals with just how we educate, advocate for, and collaborate with different patients and persons within the community settings outside of the hospital setting, and just collaborating with them in order to prevent illnesses and promote health. So for this course, we were placed in groups and we had to go to a school. My group members and I, we went to a high school. We had to come up with a topic. We actually had to do a whole lesson plan and to teach the students on the topic that we had. And for health promotion, I got an A-. So the next course I have is Concepts Applied to Nursing Clinical Practicum. So by the sound of it, for this course, I had to go into the hospital setting. Remember in first semester when I shared with you, we had Concept Applied to Nursing, the theory aspect. This is just the practical aspect of that course. So whatever we learned in the theory aspect, we now put it to action in the practical setting. For this course, I got an A. Now it was a really nice course, just to apply what I learned in the practical setting to get a patient, take care of this patient as it relates to, giving them a bed bath, making their beds, clipping their nails. It was really good. The next course I have is Patient and Healthcare Workers Safety. And generally, the course just focused on making the environment safe while caring for a patient. So now I'll be moving on to the summer semester. So in nursing school, you normally hear that we don't have no life, like literally, while other persons they are taking vacations during summer, we still have to be in classes. So if you're planning on coming into nursing school for second year, first year you have summer, but for second year, third year, and fourth year,
you don't have not named summer.
So in the summer, the courses that we did were nursing care of adults, and that's from ages 19 to 64 years of age. And we did nursing care of adults clinical practicum. So we had the theory aspect and we had the clinical aspect. Now, as the course says, it's basically caring for adults within this age, the conditions that they normally have, and how we care for them while they are in the hospital setting when they have these conditions. So for the clinical aspect of this course, we had an exam. However, this exam was done in the hospital setting. So we were no longer doing exams at school in the lab on mannequins, but we got a literal patient. And so we had to do our assessment, collect history, administer medication, plus do care plans. So for the theory aspect, I got a C+, and for the clinical aspect, I got an A-. Now, the C+ might be questionable, but for me, I'm more of a hands-on person, so I normally do better in the practical aspect of certain courses. So I really think I just wasn't as focused as I should have been, because I had to be managing being in the hospital, preparing for mid-semester exams, final exams, doing coursework, studying. That was a really tough semester for me, but I managed to pass the courses and I'm really grateful to God for that. So if you have reached this far in the video, thank you so much for watching. Don't forget to like, comment, and share this video to anyone you know it might help. And if you've not yet done so, please remember to subscribe. Just hit the red button down there. So that's it for this video, and looking forward to seeing you in the next video. Bye.